Hello, good afternoon. Today we're going to be demonstrating the 7-site skin fold test in accordance to the ACSM guidelines. Today my participant is Michael Mendoza. There are multiple factors that contribute to a measurement error when a skin fold test is being conducted. Factors include poor technique, improper calibrated calipers, inexperienced evaluators, and an extremely obese or lean participant. In skin fold measurements, the standard error of estimate is actually the standard deviation. It predicts the body fat from a given value of skin fold thickness. When conducting a 7-site skin fold testing, the participant needs to be standing in an upright position and measurements will be taken on the right side of the participant's body. There will be 2 trials when conducting the 7-site skin fold test. When measurements are being taken, the pinch of the skin should be maintained and you should wait no longer than 1 to 2 seconds before reading the caliper. The sites that will be measured are the abdominal region, triceps, chest, thigh, suprailiac, mid-axillary, and subscapular regions. Once all site measurements have been calculated, another cycle will be conducted in the same order as the first cycle of the 7-site skin fold test. This rotation allows time for the skin to regain its normal texture and thickness. When manipulating the caliper, you want to hold the caliper in your right hand with the dial facing up. Make sure to place the jaws of the calipers perpendicular to the fold, 1 centimeter below the fingers and halfway between the crest and the base of the fold. You will then release all pressure on the scissor grip while keeping the caliper perpendicular to the skin fold. Make sure to keep the fold elevated while measuring and maintain pinching of the fold with your left hand throughout the entire measurement. To measure the participant's tricep, you will engage in a vertical skin fold on the posterior midline of the upper arm, halfway between the acromion and the olecranon processes. The arm should be held freely to the side of the body. For the chest or pectoral site, you will begin with a diagonal fold. There are 2 different measurement sites between men and women. For men, you will measure 1/2 the distance between the anterior axillary line and the nipple. As for women, you will measure 1/3 of the distance between the anterior axillary line and the nipple. When measuring the participant's abdominal region, you will commit to a vertical fold 2 centimeters to the right side of the umbilicus. When measuring the subscapular skin fold site, you will commit to a diagonal fold which is at a 45-degree angle and should be 1 to 2 centimeters below the inferior angle of the scapula. If you have a participant who is obese or is overweight, what might help the skin fold measurement would asking your participant to bring their arm back. You will measure the mid-axillary skin fold site using the vertical fold at the level of the xiphoid process of the sternum. To gain measurements for the thigh, you will use a vertical fold on the anterior midline of the thigh that is midway between the proximal border of the patella and the inguinal crease or hip. For the measurement of the suprailiac skin fold site, you will engage in a diagonal fold that is in line with the natural angle of the iliac crest, taken in the anterior axillary line immediately above the iliac crest. When done measuring all skin fold sites, you will now calculate body density using generalized skin fold equations. Once the body density of the participant has been calculated, it can then be converted to a percentage of body fat using 2 formulas known as the Brozek equation and Siri equation.